controversial plans to close Huddersfield's Accident and Emergency Department. We're live at a public meeting. A meeting is underway in Halifax to hear about controversial plans to overhaul hospital services. The local NHS says the way hospitals are currently organised in Huddersfield and Halifax is unsustainable, and the number of patients dying in their hospitals is higher than the average for England. They struggle, they say, to recruit enough staff to meet national guidelines, especially in A&E. And without making changes, the Trust will face an underlying deficit of £27.5 million. They want to move all emergency care, including A&E, to Halifax, keeping only routine services in Huddersfield. But campaigners believe patient care will be damaged and lives will be put at risk. Our health correspondent Jamie Coulson is at the meeting in Halifax and joins us now. Jamie, this is the first of two public meetings, stormy ones I suspect, over the next couple of days.
Yes, that's right, Harry. As you can see, the public meeting's actually going on behind me as we speak. There's probably about 100 people here at the moment, although that's not so surprising considering much of the focus so far has been on what's happening in Huddersfield, considering they could lose their A&E as part of these proposals. Now, here in Calderdale, there are also big questions about what this could mean for patient care. Amanda Kerwin has chronic kidney disease and spends several hours a day on dialysis. She lives in Todmorden and has had to be rushed into A&E in Halifax a number of times. She's concerned about plans to reorganise hospital services, which include moving Huddersfield's emergency department to Halifax.
I feel frightened that it'll have dire consequences for me, because you've got two hospitals at A&Es at full capacity, going down to one. And I can't see that as a good outcome.
The two hospitals are 5 miles apart and currently provide a wide range of services. Under the plans, Calderdale Royal Hospital would become a centre for emergency care, including A&E, intensive care, emergency surgery and a department for very sick children. Meanwhile, Huddersfield would deal with planned care, like routine surgery, medical day cases and diagnostics, all from a new hospital site. Both sites would have an urgent care centre to deal with non-life-threatening injuries. The local NHS says something has to be done because services are no longer sustainable, and that the Calderdale Royal Hospital was eventually chosen over the HRI as the centre for emergency care because of cost, as there was nothing to choose between the two in terms of quality of care or access. Thousands of people have already marched through the streets of Huddersfield against the plans, but there have also been concerns raised in Calderdale.
We're going to end up with half a hospital each that won't be able to deliver the full range of services that people in both areas need. And the risk of overcrowding in the A&E in Halifax is quite serious.
Public opinion has partly been misinformed by scaremongers who've spread some myths and rumours about what the changes entail. There'd be a significant investment into the healthcare locally, and they'd greatly improve safety and sustainability of services.
Amanda will be among the hundreds expected at tonight's meeting, seeking answers to their questions. So they've just finished a short presentation, and now a question and answer session is going to take place over the next hour and a half or so. Now, tonight's consultation event was the first of two. There's another one taking place in Huddersfield on Monday, and if you consider that thousands of people have already protested through the streets of Huddersfield against these plans, you can imagine that might be quite a lively affair. Now, the public consultation itself will last until the 21st of June, and a final decision on all of this, a decision about what will happen to local hospital services in Calderdale and Greater Huddersfield, will be made in the autumn.
Thanks there to the soft-spoken Jamie Coulson. We'll have the latest from that public meeting in our late bulletin as part of the news at 10.